the most protective factor, more than smoking, for preventing mortality was our social integration, a sense of feeling connected and appreciated and, within a community, that it is critical to who we are. And I think, again, remember, the brain is about survival, keeping the little human beings on the planet surviving, and being together, affiliated, is a key element of our survival. And so I think that's why it's so important to kind of our brain health to feel connected and to be in healthy relationships. Healthy is important.
Welcome to another expert interview series. I'm Ben Ahrens, co-founder of Reorigin, where we teach people how to retrain their brain to get out of chronic pain and other chronic conditions. And in today's expert interview, we have Dr. Afton Hassett, who is a tenured professor at the University of Michigan and head of pain research there. Today, we get into a variety of topics based on her new book, The Chronic Pain Reset. And some of those topics include understanding what chronic pain really is, as opposed to acute pain. We also get into the brain's processing of pain and threat detection, how calming exercises and things like acts of kindness and social engagement can actually help to lessen and reduce the impacts of chronic pain, as well as the symptoms themselves. We talk about a certain study that showed recently that social connection is as beneficial to our health and mortality as quitting smoking. We discuss the power of savoring, breathing exercises to help regulate the autonomic nervous system, and the importance of not giving up and taking everything in one small step at a time when it comes to healing and recovery. First, a word about our guest today. Dr. Afton Hassett is a renowned pain psychologist whose life's work is dedicated to helping people with chronic pain live with less pain, greater happiness, and a renewed sense of purpose. As the director of clinical trials research at the Chronic Pain and Fatigue Research Center at University of Michigan, Dr. Hassett leads one of the foremost pain research teams in the world. She's an associate professor with tenure and the director of pain and opioid research in the Department of Anesthesiology. Dr. Hassett's mission is to bring evidence-based strategies from research and academic settings directly to people. And Dr. Hassett passionately teaches these skills to patients, healthcare providers, and students, and now to you, my dear viewers of the Reorigin podcast and channel. So I'm really looking forward to bringing in Dr. Hassett. This was an extraordinary conversation. I'm sure we'll have more to come. And if there's additional questions that you'd like answered, leave them in the comments below. I always like to engage to see what additional guests or experts you'd like me to bring on, as well as what questions you have, so I can find and seek out those experts to help best answer them. Without further ado, enjoy the interview. Welcome, Afton. I'm so happy to be having this chat with you. This has been a long time coming. So your book, The Chronic Pain Reset, has rocketed to the top of the charts among the Reorigin community, and I'm sure many other places as well. But this really has been, so I'm not sure if you're aware, but in the Reorigin community, we have a book club, a virtual book club that meets once a month, discusses different books and topics. It's also a place for people to recommend helpful resources. And the Chronic Pain Reset has really become the go-to resource for a lot of people because, for one thing, it's very practical, as we'll get into. There's a lot of exercises and takeaways and things that people can start doing right away. But moreover, I think it's interesting that despite the title being about chronic pain, as we get into it and as we'll learn in this conversation, chronic pain is so much broader than we normally think of. So I'm hoping you could just start out by sharing a little bit of your background, what led you to write this book, and how you think about pain in the bigger context of the human being.
Okay, great. Well, first of all, Ben, thank you. I'm happy to be here. And I so enjoy the work that you're doing with Reorigin, and we're really kindred spirits. You were one of my first people I approached to doing a lived experience reflection for the book, and your podcast on chronic pain Reset podcast is still number one.
Oh.
It keeps growing. Yeah, people have really enjoyed. I mean, more than our experts. It's there's something about your story that so resonates because I think it offers so much hope. And the book was written Mostly because we do kind of an amazing job amongst ourselves as pain scientists of communicating and leveraging each other's ideas and thinking about concepts differently and coming together and talking about things with common language. But none of this tends to make it to people with chronic pain. The patients, the people, that live with it, rarely hear what's happening in the exciting world of pain neuroscience and how we are starting to get our arms around what has been one of the most vexing human problems ever. So, my pandemic project was to maybe do something better with my time than binge watching a bunch of old series and write this book. And it was always intended to be for people, for individuals who have chronic pain, to just get a broad understanding of what it is about pain neuroscience that is so empowering, and how we do understand so much about how pain is processed. And there were so many years where it was just, it felt like an unknown. It was a vacuum. We called it multiple unexplained symptom syndromes, right? We just didn't know. Now we have a good sense. And so that was always the intention, is to write this kind of neuroscience book. The first few chapters are pretty hard to navigate. There's a lot of concepts to wrap your head around, but I tried to write it in a way that is clear and hopefully makes some sense. And then, throughout the rest of the book, I really just talk more about other factors that are so important and so impactful for how the brain processes pain, including our thoughts, our emotions, and even our human relationships.
Yeah. Yeah. So I want to get into that aspect of, first of all, maybe can we define chronic pain and how it differs from other types of pain?
Yes, yes, yes. So, I kind of begin this thought as that pain is important. Pain is a critical survival function. People who are born without pain receptors, without nociceptors, don't live very long, right? So, pain serves a protective function. It's important for us. So, acute pain makes us withdraw, makes us be cautious, and makes us guard against further injury. All good stuff. Chronic pain defined as pain that is present for more than 3 months. And high impact chronic pain is that same type of chronic pain, more than 3 months, that starts really disrupting our lives. And that seems to be kind of how we conceptualize chronic pain. We're often treating people who have a lot of impact in their lives. But what we also know, that there's a lot of people that are just out there tooling about, living their lives, even though they have tremendous pain. And so, kind of early on in my career, I was always very interested in resilience. So, who are these people that have a ton of pain and still are able to lead pretty productive, healthy lives? What are they doing right? And how do we understand that? And so we can teach others. And so that was the best we could hope for, is to help people live better with chronic pain. But now we're hoping for much more, for improvement, for cure even. And so it's an exciting time to be doing this work.
Yeah. So what are some of these different factors that feed into chronic pain? And maybe a place to start here, since you mentioned, this idea of resilience, is a chart you have in your book that I found really interesting. I found myself
Yeah.
staring at it and really thinking and reflecting on my own
Yeah.
life. But this is about personality or character traits, or how would you describe them?
So kind of they're what we could refer to as character strengths. And so, part of my positive psychology training early on is I got to know Dr. Martin Seligman and Dr. Chris Peterson and Nansuk Park, who all are leaders in the understanding of character strengths. What is it in human behavior that is right, as opposed to all of us in psychology always studying everything that goes wrong and trying to ameliorate. Instead, the field of positive psychology says, hey, let's figure out what's working and capitalize on it. And so this is really evident in the character strengths research as well as practice. And so what that involves is understanding what are your own unique innate strengths. And I kind of dedicate this unusual chapter in my book. It's very different than the other chapters, but it kind of describes what each of these character strengths are. And while there are really cool online resources, one is called VIA Strengths. If you just Google VIA Strengths, it'll take you to a nonprofit website of people around the world who are studying character strengths in every condition. And you can do the quiz and they'll give you a free PDF. And so you'll see what your strengths are. But conversely, we've done research where we have people just kind of checkbox, they know their strengths and they map on really well often. Sometimes there's a surprise or two where you might say, I didn't really think of myself as a predominantly altruistic person, but I guess, maybe I am, according to the quiz. But we're very good at identifying those. But what we fail to do is use those regularly. So if you know that you're a creative person, and you use your creativity in doing arts and crafts and things that are making materials, but you don't necessarily apply to your friendships or how you handle your job or how you think about new problems. So finding new ways to leverage and reapply your strengths. And I think this is really important for people with chronic pain, because often I hear that folks just feel really disempowered and not feeling like they have a lot of strengths or abilities, but leaning in and tapping into these character strengths can be really, really affirming.
Yeah. So let's talk a little bit about that resilience, leaning into your strengths, moving forward in the face of pain. Because the interesting thing and the that I gathered from your book and a lot of this research, including what we observe at Reorigin, is it's a bit of a twofold journey, and it's kind of chock full of paradoxes. And part of the paradox is, in order to quote unquote begin to heal or recover or move beyond the pain, it involves at first almost changing our understanding or definition of what healing is, and in
Yeah,
a sense even relinquishing the understandably strong desire to make the pain go away,
right.
right? And so at first it seems to have a lot to do with learning to not just cope or certainly not ignore or suppress the pain, but learn to kind of accept and
Yeah.
tap into our core strengths and move forward in the face of that discomfort. And then it seems like paradoxically, the more we're able to do that and practice that, somehow, and this is where I'd love you to elaborate, things feed back on the brain and it can actually reduce this central
Yeah.
sensitization type of process. Is that what you understand?
That's what we understand. And it really is remarkable. The work that we're doing now with pain reprocessing therapy, it really is some of the best illustration, because one of the central tenets is that be with your pain. Spend a moment not pushing it away, not freaking out about it, but just saying, oh, what is it doing? What does it feel like? Is it changing? What color is it? Is it floaty? Is it sharp? Is it different around the edges? But actually, this very process of just cracking open the door and being with pain actually changes the pain. And so we think this is predominantly due to how the brain processes threat. And we very much feel that a lot of pain is either made worse or created almost entirely by the brain's sensing a benign signal as threat. And when you sit with the pain and are open to it, and the intervention says, think about it as if you're putting safety goggles on, right? That you're thinking through the lenses of safety, thinking, I know this pain is not going to kill me. It's there. It is not a threat, and it's interesting. And that often will change the pain. It'll make the pain hop to a new area. And to us, that is absolutely so fascinating, because it is really a really strong example that the brain is indeed misinterpreting benign signals as a threat to the host, and creating this real intense sense of pain. You need to avoid this, get away from this, you're in danger.
So just simply understanding that pain or discomfort doesn't equal danger, that
Mhm.
alone can start to change the way the brain interprets
Yes.
those signals.
Yes, a 1,000%. And it's so interesting. And I know many people who have chronic pain say, hey, my case is different. I have an MRI of my back and my discs are a disaster. The surgeon won't operate on him, but I've seen what that is. And yes, you should have a physician absolutely rule out that this might be causing the pain. But what we do know is that almost all of us, once you get over 40, have weird findings on MRI. We have weird, scrunchy looking things. Our knees may look terrible and you might not have any pain in your back or your knee. Other people can have, a lot of pain in the back and have kind of an iffy looking finding, and they're, and then the physician says, well, that's probably causing it. So I mean, there's many reasons why we have these mental maps of what causes our pain, but so often the thing we see on the MRI is not what causing the pain. It may have initially, that you might have tweaked your back, 5 years ago doing something like that, and it healed, and it still looks a little funky on MRI, but it's actually the brain that's creating that pain there. And so again, if you have a physician that can help you weed through some of this and feel comfortable that, you know what, I do think this is brain driven pain, and I feel safe, that's when people can really start to turn a corner.
Yeah. And I know that's a big question for a lot of people because the pain sensations are really convincing, right?
Oh yeah.
Like I've had that. I've had low back pain where I was 100% certain that something was seriously misaligned structurally in my back. And I went to a chiropractor and he said, there's nothing out of
Yeah.
whack, and
Yeah.
the next day I woke up, I remember having a bit of an emotional release and that I think combined with the information that there was nothing structurally wrong with my
Mhm.
back
Yeah.
somehow released something. And what I had
Yeah.
insofar as debilitating chronic back pain for 4 months was
Yeah.
was gone. So
Incredible. Yeah.
fascinating. Yeah. And I think you mentioned in your book the story about your knee, how I think
Yeah.
you had some arthritis or something that when it was checked out, but you had no pain, right?
Okay.
Until
Yeah.
yeah.
Hideous. I have a hideous knee. And it is stiff. I mean, so, I know I don't have the flexibility. I have zero pain in it. And, and my physician's assistant said, it's really awful. So, it just depends on the individual and how how their sensitivity, what their tuning is set at.
Yeah. And so I think that's a big question for a lot of people is like when and how much, to pay attention to this and to protect it in a way. And I think that's where, just certainly going to a doctor and removing other confounding factors, just making sure that there is nothing, in fact, structurally wrong that requires other attention. But let's say once someone's gotten to that point where they've ruled out other factors, they've determined, okay, this is probably nociceptive pain or stemming
Mhm.
from central sensitization.
Yeah.
Now, how should they engage with that, and how should we interpret this idea of resilience and tapping into our core skills in a way that doesn't have us just pushing through it, right? Because we don't want to push through and then crash or make things worse. So how do we find that balance and
Yeah.
work with it?
Such a great question, Ben, because it feels like a really big open field. Where do you begin? So typically, what we ask people to do is to just kind of take stock of what's going on and what are these other factors that can be simplified in their life. So, for example, if someone's not sleeping well, for Pete's sake, let's get you sleeping well. That's one of the first things that it's so powerful. If people have been not moving at all and have gotten very deconditioned because they were pretty sure the injury was something that precluded their ability to move, get you moving again. Once you're reconditioned, it's amazing how much pain can get better. Once you have, once you're walking and doing things. If your life is very, very stressful, then again, let's think about what are some great coping skills to help you deal with stress. And then thinking about how can I more directly impact my pain. So thinking about programs like Reorigin that are going to help you dig in and start to test some of these hypotheses that the brain may be driving some or maybe even all of this pain, and do what you can to start making those small tweaks to how you're experiencing your pain.
So one question that's come up a lot in the reorigin community is around kind of how we should think about nociceptive pain. And there seems to be some confusion sometimes just because there's a lot of different voices, a lot of different literature
Yeah.
out there. And I think on the positive note, it's becoming much more widely known that the brain plays a critical role in perpetuation of pain and perpetuation of inflammation. And it's not to say that it's the cause of the problem, but it plays a role, which is empowering because we know through neuroplasticity we can affect some changes there.
Yes.
But one of the common concepts or in a sense sort of misconceptions that I see is people thinking that pain is just a thought or nothing more than a
Ah,
thought or all
yeah.
in our heads, right?
Yeah.
and it has to do with the head because the brain is there, but
The brain.
it also, of course, has to do with these other factors, the body. I mean, you just mentioned movement and sleep, and
Yeah.
we'll get into things like social connectedness. So there's a lot going on here. So how do you kind of think about chronic pain, and is it just a thought, or is there other aspects to it?
Yeah, so interesting, and yeah, there's kind of a lot to kind of unpack there. So when we think about we kind of divide pain into a couple of buckets. So there's nociceptive pain, which means that there's something that's being detected out there, right? There's either a scratch or a twist or or a cut or a bruise or something like that. There's something that's tweaking the little receptors, and they're saying, "Hey," sending a message to the brain. This is something painful. This is acute pain. That's what acute pain is about. Is that something's been damaged in the periphery, someplace outside in the body. Nociplastic pain kind of refers to this notion that noci, pain receptors, plastic, the brain now has changed, right? So the brain is either driving the pain or it is fully creating the pain, right? So that's not to say that it's a thought, right? This is just the brain doing its protective function. We kind of forget the brain is so marvelous and complex, but it's also very ancient and kind of primitive. And there's parts of our brain that are just so primitive, like the parts that allow us to breathe and to and just to function and move. And then our emotional parts of our brain are also very, very old, very, very old machinery. And even the cognitive parts of our brain are a little bit of a mush, meaning that the brain's main job is to keep the organism alive. And one of the things that it does very well is it seeks threat and it makes threat known. And so it isn't a thought that you're having that you have pain. It really is the brain saying, there's some danger here. Pay attention. I'm going to send some pain. How about that? That might get your attention because you might, there's clearly some threat. So now where the thought comes in, the threat can be something that you're thinking, right? And you might think, oh my God, I've got a deadline and what am I going to do? And it's not life threatening, but your brain is going, oh, there's a threat out there. And that can even start pain. I think, Ben, you were mentioning that you had this, something that was happening in your life that, once you kind of were reassured that it was not a structural thing and you had some sort of emotional release, whatever it was, their brain's like, okay, oh, no longer under threat. Okay, the organism I know is safe. We've been told by a doctor it's okay. And this other thing that may have been bottled up now is out. It's no longer some percolating, nameless, nebulous potential threat. And so that's where we get in a little bit of trouble when we do have, all these things in our lives that cause a lot of stress and we just kind of bottle them up or we allow them just to become so overwhelmingly stressful that the brain is starting to feel overwhelmed and that there is a threat. And so it's going to send some threat messages. Your heart's going to beat fast, you might not sleep well, and you may experience pain. There's many ways that the brain says threat is out there.
Hmm. So, okay, so it isn't that the pain is just a thought or it has to do with directly something that we're thinking, but you have a chapter in your book on thoughts,
Yeah.
and interestingly, there's a strong connection in that when we're thinking more. I love that you call them unhelpful automatic thoughts, by the way, instead of necessarily negative or automatic
Or bad.
negative thoughts, or bad,
Helpful.
right? Sometimes putting that extra layer of value judgment on it can add that insult to injury. But I love that just removes the judgment and says, you know what, helpful or unhelpful. So if we're having a lot of unhelpful thoughts,
Yeah.
right, then that can, if I'm understanding correctly, that can kind of just amplify or boost up this peripheral sense that
Yeah.
we're in danger, that things aren't wrong, and it can kind of turn up the volume on the brain's threat detection mechanism, right? And then it'll be even more prone than it usually is to pull out the signal of the discomfort.
Exactly, to ring the alarm bell. And then we all are very different in what we detect as threats. So there is just kind of a biology to how we're wired. Anybody who's a parent and has multiple children will say, okay, well, this one is really slow to warm. This one's very, very anxious. This one's right in the middle, right? It's just very, very different, but it is kind of part of how we are. And so some of the work that we've done, we do think that individuals who develop chronic pain tend to just be a little bit more sensitive, that their entire central nervous system is a little bit more sensitive to light, to sound, to emotion, to threat. I mean, all of that is just amplified a little bit in many, many people. And so, what might feel threatening to one person might not be threatening at all to another. And so it's very, very different. And what we do when we think about, removing unhelpful thoughts from our from our day, is we start dialing down opportunities for threat. So if you're thinking a thought like, I'm not a very competent person, I don't know why anybody would ever want me to work for them, which is pretty unhelpful, that it can be interpreted by the brain as a threat, right? Because now you're starting to probably have a little bit of heart rate activation and a little anxiety around that, and think, how am I going to pay the bills? And now you have your body in a little bit of a state of threat. And then the brain is like, okay, threat. And so maybe pain is what is sent to try to preserve the organism.
Yeah. You had that study you mentioned in your book about how people with chronic pain, I think when they applied pressure to their thumb, they experienced it. What was it? Twice as much, basically.
Six, yeah, yeah, yes, yeah.
Yeah.
You could apply like six times as more, pain to somebody who does not have chronic pain to their thumb bed to get the same neural representation, the same, pain alarm. So that tells us, and I think that's been a central tenet of nociplastic pain. How we understand it is, it is the central nervous system is just highly tuned, and people will say this, man, I can't walk into a grocery store and kind of feel overstimulated. There's too many colors and people and smells, and so again, it's just a sensitivity that some people have and make them even more prone to having chronic pain and some of these other conditions.
Yeah. Okay. So this in my mind is starting to make sense. So one of the unique things about your book is just the scope of the different types of practices that it goes
Yeah.
into. And again, the book on the surface is about chronic pain, but once we get into it, as we're talking now, I'm actually just starting to understand really a lot of it fundamentally has to do with on a well, I'll say global level, the whole brain, body, mind, helping us out of this threat state and into a state where we feel more connected, supported, resourced, at ease. And so, for that reason, you have 30 days worth of practices, all of these different types of practices that involve calming exercises like different types of breath work, mindfulness, guided imagery, savoring, but also things like acts of kindness.
Yeah.
So, I want to get into this chapter, and you have a chapter on social connectedness, the role of integrating into society in certain ways. And in the beginning of that chapter, you shared a study about how basically social connectedness is as effective for health outcomes as quitting smoking, which
Yes.
is remarkable.
for
Could you say a little bit
for
more about that?
mortality, yeah. And it is not just health outcomes. There's many, many, many health outcomes that social connectedness is associated with better health outcomes. As a matter of fact, it's so prominent that our current Surgeon General talks about, or wrote a book on loneliness and health, because it is such, it's such a critical thing. Vivek Murthy and his interest in how social connectedness is so important and so protective. So yeah, so the study that you're referring to was conducted by Julia Holt Lundstedt, and what she did is she found every study she could out there. It's a meta-analysis. She found every study she could out there, brought them all together and said, okay, let's see what's protective against mortality. And she looked at things that you would expect, like clean water and clean air, getting vaccinations, treating hypertension when you have it, drinking less if you're a problem drinker, fitness, low levels of obesity, and all of these, as you would anticipate, and looking at all the some body of literature, are indeed protective. They do decrease mortality. The big boy, of course, is quitting smoking. So that had the biggest effect. The people who quit smoking were at much less risk for dying. But the one factor that she found that just blew everybody's socks off, the most protective factor, more than smoking for preventing mortality, was our social integration, a sense of feeling connected and appreciated, and within a community, that it is critical to who we are. And I think, again, remember, the brain is about survival, keeping the little human beings on the planet surviving, and being together, affiliated, is a key element of our survival. And so I think that's why it's so important to kind of our brain health to feel connected and to be in healthy relationships. Healthy is important.
So one of the things that happens when people are experiencing chronic pain and other symptom clusters is a withdrawal or this avoidance behavior, which again is super understandable. It's like
Mhm. Yeah,
when our energy is low and we're in pain, it's we don't want to be around other people. And I think you even described in your book how this is also a protective response that when we get sick with an illness or something, the body releases these cytokines, some of which have this effect that make us feel exhausted and tired,
yeah,
so that we don't actually go out and spread the pathogen or something. But in this case, and in the case of these more self-perpetuating conditions or post-viral fatigue or post-concussion syndrome, these issues where they are now persisting beyond the point where we have a current infection or current structural problem in the case of pain. Now it actually behooves us to start to undo that. So I'm curious, it's such a hard cycle to break. It
yeah,
can be like a downward spiral, and it has so much momentum when the pain begets isolation, which begets more pain and anxiety and depression. Everything gets loaded on top of. How do you recommend, and what would be your approach or advice to someone who wants to start to break this cycle and
yeah.
transform it into something different?
Yeah, and that's so hard. And I hear often from people with chronic pain that one of the wild cards, even if they want to interact, is they're so unreliable. It's so hard because you don't know if you're going to have a bad day. So you don't want to plan this big day out with your friends and then have to stand them up again. So that's so hard. And so the recommendation is that don't give up. So, but maybe just plan differently. Make sure that they're all coming to your house or you're just going to your girlfriend's house that's, a block away. So, set up these social reconnections with success in mind. But yes, you're right, Ben. Sometimes it's really hard even to take that first step. Right? We wonder if we've burned too many bridges. We wonder if, who do we reach out to? We wonder if maybe the relationships that we had before are not terribly satisfying. So, each person's unique circumstances will dictate kind of how they move forward. But my suggestion is do so slowly and just a little bit. And maybe some of it is even social media at first. Connect with people on Zoom reliably. And then, when you feel better, then you can get out. But the main thing is to, continue to have this sense of social connection with people who are provide a healthy supportive world for you, that that you feel connected and you like these people. And my other big piece of advice is one of the days in the 30 days of activity, skills, and practices is to create a relationship tree. And that's where we do some pretty clear examination of the relationships in our lives. And we kind of create this little graphic of, are the relationships that are closest to you the ones that are the most supportive, or are they the ones that are the least supportive? And how do we make some changes in our life? When your energy is finite, it's really important to invest in the relationships that are mutual, right? That where you give and you get, and the person is kind, and rather than we often put all of our energy into our negative relationships and then we're too exhausted to build the good ones. So, it's making some hard choices too when you're kind of ready to emerge and start embracing your friendships again.
That's such a great reminder, and also just a reminder of the sort of forgotten power of going through an experience like a chronic illness or chronic pain, which is always hard, if not impossible, to notice while you're going through it. But if I remember back to my own experience, I think one of the superpowers that emerge from there is discernment. It's
Yeah.
because no matter what level of health or vitality we're at, in some sense, we're always limited. We only have 24 hours in a day. We only have so much energy we can expend and things we can focus on. And so a lot of, I think, living a good life has to do with discernment and filtering. Where should our focus be? Where should our attention go in a given moment on a longer term? And I love that you said, the key is really don't give up
Yeah.
and try different approaches. At
Mhm.
Reorigin, we really advocate the science of small wins,
Yeah.
breaking things down into the bite size, because we can all get caught in those, especially when you're down and out or tired, fatigued for a long time. Things build up, and there's this propensity to want to make up for lost time, right? I need to make up for the time that I wasn't able to socialize and make a big plan to go on a big vacation with a bunch of friends or something. And then, of course, that actually leads to pressure in anticipating
Yeah.
the amount of effort it's going to take. So, yeah, I think an approach that we've seen work really well is just setting small, more
Yeah.
attainable goals, which can simply be, text someone today, reach out to
Yes.
someone on text message.
Yeah.
And one interesting thing I'll share, this is something that we have just anecdotal evidence. I'd love to gather some more research on this. But a really interesting thing is I have a lot of people reach out to me after they've joined Reorigin for like the first week, and they say, I'm feeling so much better. And I say, oh, that's great. Like, how far along are you in the program? And they're like, oh, I'm in, day 3, which
Yeah.
means like so just to give you a sort of, context there, the exercises and the neuroplasticity training exercises start at day 7,
Yeah.
right? And so a lot of people, they'll report that they're starting to feel better just from engaging in the community,
Yeah.
seeing other people there. And for many people, it's really their first point of entry back into social engagement.
Yeah. I love that, Ben. And I think the other thing that you offer too is hope. There is something you can do, and I think it's been so frustrating to people with chronic pain over the years. It's like you just have to be a passive recipient, right? So, who's going to give me an operation? Who's going to give me a pill? Who's going to do physical therapy at me? Rather than, what can I do? How do I take this, my healing into my own hands? And that's, I know the premise of Reorigin, the premises of the book is that, a lot of the answers already are in you. It's just helping you get the tools so that you can unlock it.
Yeah. So let's on the hopeful note, I'd love it if you could share some stories, either people that you've worked with, or you have a lot of great of these lived experiences that you share in the book. What are some of these stories that show how people have changed their lives in the face of chronic pain, or even changed the pain itself?
I have one I will share with you. Normally, I wouldn't share this, but she was just a guest on our podcast. And so, this is a woman who is very high profile. She was the press secretary to Dr. Vladimir Zelensky, who is the president of the Ukraine. And this is a woman who came forward and said, I have chronic pain, and has since been living the life that many people with chronic pain live, trying to find help, trying to having life disruption, having things change in your life. And we worked with her and kind of went through the process of helping her, rule out that, is it structural? What is it? And then she has been working with some of these neuro, plasticity programs with pain reprocessing therapy, and has been sent to Reorigin, hopefully to continue her training. But this was such a helpful, hopeful case where she went from having just devastating pain to using these techniques and is now like a different person. Yes, the pain comes and goes, and she talks about it in the podcast and what her experience is, but it was just transformative, like a snap that just, at the one time realizing that this is not necessarily a structural problem, that this is something in the brain. And at that point forward, having the keys to unlock the door. So to me, that was just really so encouraging. And, and to have somebody, this is the other piece too. She said that what made it okay for her to come forward was that Lady Gaga had done this. And the more that we come forward and say, hey, this is my life, like you are, Ben, to say, this is what I went through and this is how I got here. That's so empowering. So other people say, hey, I have chronic pain, because so many people suffer alone and suffer in silence, and they don't have to. There's treatments, or there's communities. And I think, I'm just so moved by people's willingness, especially, in a high profile situation, to say, hey, this is my situation. So it's okay. Regular people get chronic pain.
Yeah. It's interesting about, like Lady Gaga and others coming forth. There really is something that when this is normalized, when it's put out
Yeah.
there, it's almost like people's nervous system can just intrinsically take this sigh of relief and be like,
Yes.
oh, my experience is validated,
Yeah.
and this makes sense. I think
Yeah.
that's what I notice is what's interesting to a lot of people is like as they read your book or they go through a Reorigin program,
Yeah.
it just makes sense. It
Yeah.
really, what they're reading actually affirms their own experience, and then leads into that element of hope that you can actually transform your experience of it. So in your book, you have a ton of different ways of transforming it. One of the questions that one of our members asked, which I love, is which is your favorite, if you have a
Oh,
favorite?
oh, it's like asking what's your favorite kid.
Yeah, I'm sure they're
I
all.
love them all. They're almost all of them very evidence based. Some have a little less evidence, but are still things that we know have been shown to be effective in people with chronic pain and other conditions. So there's many of them, but I think savoring might be one of my favorites for its simplicity. And savoring is built on the notion that our brain is very good at tucking away negative events. It does so for survival. So if you see a snake, that is seared in there. You'll be able to recall that moment instantly, right? That's just how the brain remembers things. It's less adept at remembering good stuff. So the moments of pleasure and comfort and happiness and contentment get lost. They're just not recorded very well. And then when people have chronic pain, we even see neuroadaptations in the reward processing areas of the brain. So the part of the brain that says, "Oh, this is great," or "Wow, go do that. That looks fun." That part of the brain often isn't working well in many people with chronic pain and other conditions like depression, post-traumatic stress disorder. There's just a number of conditions where we see a reward processing deficits. And so savoring is one of the activities that has been shown to actually help kickstart that part of the brain working again. And so savoring, just as simple as it sounds, is that when you find yourself enjoying something, it could be food, it could be a friend, an afternoon with a friend, it could be curled up in your, favorite fluffy pajamas, whatever it is. But when you find that moment of just utter joy, stop, recognize that you're in the moment, take it in. What do you feel? What do you smell? What do you hear? What is a thought that you can link to it? So you say, always remember. And so catch yourself in those special moments, just saying, remember, remember, remember. And when we are intentional about locking those positive memories, and they do stick, they become more sticky, and they become like little boxes in a closet, right? You have them stashed away, positivity boxes for later. So I love savory because it's something you can do every single day, any day, and it's fun and it's 20 seconds of your life.
Mm. It's interesting. Yeah, I've heard a lot of flow researchers and even athletes and people do this unknowingly. But like Stephen Kotler talks about how he's always chasing flow states and organizing a lot of his life around things like writing and
Yeah,
mountain biking and activities that induce flow states. But he said what his new hack is that when he goes to sleep at night, just before he goes to sleep, his head's on the pillow, he goes back and cycles through the day and recalls those moments of flow
yeah,
and then kind of
yeah,
really savors them. And I've heard this
yes,
from Kelly Slater as well, who's my favorite surfer, 11-time world champion. And since he was a young boy, he would just constantly pull from this library of great waves in
yeah,
his mind. And
yeah,
every single night when he laid down on the pillow, he would just really put himself right back in that place and savor it. And it's something I've started doing just even with the littlest things. It doesn't have to be catching a huge wave or doing something totally radical, right? It can be
yeah.
savoring a cup of tea.
Yes, exactly. The sunshine on your face, the smell of fresh cut, grass, and whatever it is, that just kind of brings you a little joy. Often they're often it invokes a memory. It could be something take you back to a very special time with a person or as a child or whatever, whatever. Or sometimes it's just something is just really yummy, or you're really loving being with a person that you don't often see, and just that moment, just that snapshot. It's important just to savor, and you do lock it away better if you engage all the senses.
Yeah. Yeah. So I highly recommend people, check out the book just to mention some of the other activities you have in here, self-compassion, time-based pacing. There was a question about breathing that I'd love to hear you weigh in on, because that's actually a question we get a lot.
Yeah,
So yeah, let's go there just for a moment.
yeah,
The question that always comes up is there people think of it like a combination lock, right? Like, is there a specific best breathing
yes.
pattern like for
Yeah.
chronic pain? And is there a different one for fatigue? And,
Oh,
how can
interesting.
we think about
Yeah.
breathing?
So this is some of my earliest work, my very, very earliest work when I was a brand new baby faculty member back 20 years ago. We were studying what we call heart rate variability biofeedback. And what the premise is that how you breathe will change how your heart rate flows. And by doing that, you can impact what your sympathetic and parasympathetic nervous system is doing. So your fight or flight response, you can directly impact that part of your autonomic nervous system through breathing. And so we studied this breathing pattern in people with fibromyalgia and people with depression and a number of other conditions and asthma. I mean, all sorts of conditions, and found that this breathing practice was really powerful. And so it came initially from the monks in Tibet, who one of my mentors went to go study, and he found that what they do when they're in deep meditation, when they're so peaceful and able to change their heart rate and change, what are typically non-optional bodily processes, they did it by breathing it a certain way. And what they did is they were just breathing at 6 breaths per minute. So just a slower, comfortable rate of breathing. And so there are breathing pacers out there. You can go on YouTube and say 6 breaths a moment breathing pacer and just spend 10 minutes. Start with 5 minutes. But it is what we have found to be probably the best breathing technique to really just dial down, stress, to change really how the autonomic nervous system is functioning. We see in many people with chronic conditions like chronic pain and PTSD that their sympathetic nervous system, the part that screams fight or flight, is really activated. Even when the person is sitting there looking really chill, they're just underneath, they're like, oh. And so the breathing at 6 breaths per minute, we watch with our biofeedback equipment just knock down that sympathetic wave, and the parasympathetic wave grows, meaning that the part of our body just says, calm, relax, be peaceful. When we're feeling our most content and delighted and loved, that's usually parasympathetic activity. And so breathing at 6 breaths a minute is one way to start, making the autonomic nervous system really look more like you would at the most happy moment of your life, the most peaceful, calm, most content moment. So that's my favorite. In through the nose, out through the mouth, just kind of like blowing out a birthday cake, but don't hyperventilate. Do it slowly and then sneak up on it.
Yeah. Yeah. And I guess it sort of taps into that bi-directional communication, right? Because it's interesting that when we are at ease, that seems to correlate to the breath naturally slowing down.
Yes.
But we can
Yeah.
also use intentionally slowing down the breath to feed back onto our state.
Yes. And it's so powerful. You wouldn't think that, but yeah, it really has a powerful influence on decreasing the anxiety and fear.
And it's simple. It's simple too. It's not some super hyper detailed, elaborate,
No.
breathing. It's basically just slow it down, intentional, longer exhales. Yeah, that's great. Well, Afton, I know we're coming to the end of our time here, and we could go on for a long time and touch on so many of these other subjects, and we'll have to do a part two. That would be
Oh,
great.
glad to. Yeah.
But before I let you go, I would love to just hear if there's anything that you're working on that you'd like to share, any message that you'd like to put out there, word of encouragement or hope, or really anything. Yeah.
Yeah, I think the most important thing is don't give up. It's incredible. And we have people that come through our clinic and are trying some of these more novel interventions that have had pain for 20 years and have tried everything, including surgery and on and on and on. And then just trying some of these novel kind of brain retraining techniques are like, oh my God, you could knock me over with a feather. I didn't think that this would actually work. And so it's usually different combinations of things for different people. Some people need to get a little bit more exercise. Some people need to get their sleep. Some people need to deal with trauma. But it is, for each individual, figuring out, what are the pieces that kind of feed into having some difficulties and dealing with them. So it's not just for people with chronic pain. So much of what's in this book is just for living well. So many of the things in Chronic Pain Reset are just like, it's kind of like a owner's manual for humans for the most part. Many of my people with pain say that they give it to their husband. Here, this is for you. Or my clinicians that read it for their patients say, wait a second, I'm using these things. So, so much of it, we all have our things. There's nobody out there that's perfect. It's just being willing to be self-compassionate and figure out, what are the pieces that you want to be able to move and how can you kind of start your retraining.
Wonderful. Where can people learn more?
Oh my goodness. AftonHassett.com. Happy to see you there. You can communicate with me directly if you like. The book, there's a podcast. Ben was on that, as I mentioned earlier, Chronic Pain Reset podcast on Apple Podcasts. And there's a wonderful audiobook. I've heard from a number of people with chronic pain. It's just really hard to read and they have some trouble focusing. And so the audiobook is beautiful. Exie Sands is the narrator and she's just dynamite. So yeah, so please reach out, please connect. And I hope you find what we're offering you, Ben and I, to be helpful.
Thank you so much, Afton. Much appreciated.
You bet.